Let's move on to the King Kong of weight loss. There's a lot of conversation out there to say, are these weight loss drugs like Mounjaro and Ozempic only for the elite? Now, I've done some research. I am told that it's typically for a time of 72 weeks that one needs to take the drug, which is a little beyond a year. And the average dosage for 5 mg is about 4,300 in India. If you've been in the drug for a year, and not the starting dosage and not the tapering dosage, but I'm talking about the center part of it. If it's say about 10 mg, so we're talking all roughly about 9,000 rupees per week. So is it fair to say that the average amount of money that you would spend on a drug like this would be 50,000 with?
Now remember, when we are talking about weight loss here, we are not talking that you want to make you thin. We are here to give you metabolic health. When we look at a person like a diabetes, how much weight loss I want? I want 10%. But not only Munjaro, but there are other drugs which are there, like liraglutide, which can also help our patients to lose weight, and these are very cheap. We don't have to give a 30 kilo or 40 kilo weight loss to each and everybody. What we are looking at, that what is your goal, what diseases you have, what is your stage of obesity. So we stage the person. You have type 2 diabetes, you are in stage 2. You have an osteoarthritis, you have stage 2. You have a heart disease, you are in stage 2. But if you have a person who has got heart disease tented already, he's in going into stage 3 already, because he's living the complications. Minimum you should do it for 6 months. You should buy these 6 months to inculcate those behavioral changes. What behavioral changes? Circadian rhythm, the circadian clock has to be adjusted and corrected. Those 6 months you should buy to do that. Number two, resistance training and protein intake is very important with these medicines. And eating right and moving more, rhythm has to be corrected. Sleeping in time, screen time, all this have to be corrected. So if you do that within this 6 months, you need not necessarily take the drug for 72 weeks, as you said. I want to lose 20, 30 kilos. Then elite can only afford that kind of a medication because it's costly, and we understand that it is going to be 40,000 rupees. Once the patents are gone, you will see a lot of biosimilars coming in. There are 10, 12 drugs which are going to be in the market. You will see everybody, these drugs will reach to all the spheres.
Thank you. I'm summing up what you just said. First of all, when you're on some of these drugs, do not look at your weight, look at your disease condition at that moment. And that in turn should decide this is a drug, not a vanity kit. So let's not look at it as aesthetic. We should look at the underlying diagnosis of what your body is really telling you. What I also heard you say is it's about ticking all the right boxes. So the drug alone is not going to do anything unless you're going to make those systemic changes of your circadian rhythms, protein intake, the strength training that you're doing. So it's an amalgamation. So it's a lifestyle change. It's not just a drug induction that you're doing to your body.
Absolutely, absolutely.